chains of transmission, so prevent people from getting infected, but also from saving lives. What we understand about mortality, there's different ways that mortality can be calculated. And if we look very crudely, if we look at the number of people that have died over the number of people that have been reported, you get a certain percentage. What many groups are looking at right now is what we're calling the infection fatality ratio, which is looking at the number of deaths among all of the people who have been infected. And right now, we don't know how many people have been infected because there are challenges with surveillance and detecting every single one of the cases. And certainly, there are many unrecognized cases at the moment. What we understand from many of these studies, these are estimates of the IFR, the infection fatality ratio, is that the estimates hover around less than 1% of 0.6%. And there are a couple of studies that are out that have estimated this 0.6%. That may not sound like a lot, but it is quite high. If you think about a virus that can transmit readily, that can transmit well, and in fact, overall, we have more than 17 million cases, and we still, there's a long way to go with this pandemic. 0.6% is quite high. And so we need to do everything that we can, not only to save lives among the cases that we know about, but to prevent as many infections as possible. And that leads to all of you who are watching, all of you, who are part of this fight with us. Not only do you need to prevent yourself from getting infected, you need to prevent you passing it to someone else who may be part of a vulnerable group. We do know that mortality increases with age. We know that mortality increases among people who have underlying conditions like chronic respiratory diseases, chronic heart conditions, obesity, diabetes. There are many different groups that are at a higher risk of severe disease and death. So we must do everything that we can to prevent ourselves and those individuals from getting infected. Mike, do you want to say something about the therapeutics?
Yeah. And maybe also just putting in a bit of perspective, when we look at the infection fatality rates, that's the deaths in all those who are infected, whether you know it or not. That 0.6% is just over 1 in 200 people infected potentially dying. That's hugely skewed by age, and the risk is much higher in older age groups. But if you compare that to the 2009 pandemic, it was more like 1 in 10,000 or up to 1 in 100,000. The ranges are very wide. But when you think 1 in 200 versus 1 in 10,000 or 1 in 100,000, you get a sense of just how more deadly this virus is in communities. And again, points to the fact that we should try to avoid being infected. As I said at a previous press conference, while you may not become very sick, the long-term health implications of being infected with COVID-19 are not well understood. So it's not only important that you avoid infection for the perspective of your own health and ensuring your long-term good health, but that you don't get infected and be the reason that somebody else is infected. And I think this is a moment of a huge need for our collective solidarity as a human race. We can go around this, and there's a huge amount that governments need to do, and there's a huge amount that we need to do to support communities in order to facilitate this. But in the end, this virus moves from person to person. And that virus jumps when we provide the opportunity for that virus to jump. Some people don't have the opportunity to prevent that jump because they live in very difficult conditions, and we have to support them as much as we can. But many people have a choice, and younger people have a choice. And when we talk about death and fatality, that is the outcome of an infection. And an infection is an outcome of an exposure. If people are not exposed to the virus, they cannot be infected. If they're not infected, they cannot infect anyone else, and they don't die. So we need to push back to the concept of exposure. Everybody on this planet needs to do whatever they can to avoid exposing themselves or exposing others. And that's why the Director General has spoken today about doing it all and has launched a mass challenge to add into that the importance of mask wearing in the appropriate setting. So everything we do to reduce our exposure or exposing others will add benefit to this. So it's macabre to talk about deaths and fatalities, but in the end, that starts somewhere. And it starts with each and every one of us doing everything we can to reduce our chances of being infected so we don't infect others. There are many, many situations where that's very difficult to do, in closed communities, in long-term care facilities, in prisons and other places, and that's where the government and the state need to step in and ensure that the right support is in place to reduce exposure. But for those of us going about our daily business, going to bars and going to shops and going to all of these different things, we have choices. Maria said it before. You can choose. You have choices. And I hope if we focus on that, exposure reduction, infection reduction, then we'll be talking about mortality going down. Because this virus, as the DG said, is dangerous, it is vicious, it is deadly in older individuals and those with underlying conditions, and we just don't know the impact that this is going to have, even in those moderately unwell with this virus in younger age groups.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. We are definitely on the hour now, so this is the last question, and it goes to Emma Fudge at Reuters. Emma, please unmute yourself and go ahead.
Thank you. Very quickly, I was just wondering if you could comment on the remarks made at the weekend by White House experts about the epidemic entering a new phase.